Thank you. So, what do 191,000 cats tell us about how we can help them? So firstly, really how big is the problem in Australia? And Joy presented some calculations that she did yesterday, what she had done based on the New South Wales data. I did some based on some of the Victorian data and included a couple of the big shelters down there. And so I came up with a larger number of dogs and cats that were euthanised. But I think that the bottom line is it really emphasises the need for transparency, and particularly from municipal councils. The only two states that I'm aware of that have collated data for the whole state are Victoria and New South Wales. And I think there's a need for everyone to be transparent so at least you know where you're making progress and where you need to make progress. And some work that a fifth-year vet student did where she looked at the number of animals that were euthanised in veterinary practices that had a good or very good prognosis. If you include that number, then it's more like 400,000 cats and dogs every year are euthanised. We heard yesterday it's about 3 million dogs and cats in North America, and in fact the number that are euthanised per head of human population are very similar between the two countries. The USA is just about 20 times bigger. How big's it costing us? How big's the problem? Some data from several years ago indicated that Australia-wide municipal councils were spending over $83 million every year trying to manage the dog and cat problem. Another 180 million is estimated to be spent through animal welfare agencies. So this problem is consuming about $250 million every year. So how are we doing with this? There's also a cost, a psychological cost and a human cost, which is usually not factored in. And some work that's been done both in Victoria and overseas has suggested that of people directly involved with euthanasia, 50% of those will ultimately end up suffering from some degree of post-traumatic stress. And that results in various symptoms such as depression, substance abuse, high blood pressure and sleeplessness. And it's been shown in the States that the rate of staff turnover in shelters is directly proportional to the euthanasia rate. So there is a human cost and it can be quite significant. And when I talk to our fifth-year students who have just spent 5 years learning how to diagnose, manage, treat and prevent disease and tell them that euthanasia of healthy homeless dogs and cats is in fact the leading cause of death in this species, and that being unwanted causes more deaths in pets than anything else, they're actually quite shocked, and some of them are quite confronted by this. And it really questions that they've just spent 5 years almost learning about disease, when in fifth year it's really the first time they learn about the magnitude of this problem and also the responsibilities. So how are we doing now? The RSPCA is one of the shelters that welfare agencies that is very transparent, and I think that is important. And so if you look at what's happening, this is data, as you can see, over a number of years, and the number of animals, dogs and cats coming into shelters hasn't appreciably changed, with expenditure around Australia of about $250,000. And yes, our population is growing slowly. So what is the problem? Well, if you look at the data, again, this is a little bit out of date, but it's not appreciably different now. So what's coming into shelters are mainly adult dogs, adult cats and kittens. And puppies in most of the areas, although they're coming into shelters, aren't as much of a problem, and except in the more rural areas, usually can be found homes. If you look at dogs and cats separately, you'll see here, if we look at the reclaim rate for dogs, it is steadily going up over the last 7 years. And you can see that euthanasia rate went up a little bit and came down, but it's not appreciably different, the numbers euthanised over if we go back 7 years. And if we look at cats, you'll notice straight away that the red and the blue line is reversed. And so for cats, if we look at the euthanasia rate, it has gone up and now it's on the way down. So it's going to be interesting to see what the next year figures show. But again, if you look back 7 years, we're not doing any better in total number that are euthanised. However, the reclaim rate and the rehomed rate is steadily increasing. So clearly there's more cats coming into the shelters and we need to address that. So I'd just like to pass over to Corinne Hanlon. She's been doing a PhD at the Centre for Companion Animal Health at the University of Queensland, and I think her data is really so important in forming strategies and where we need to be directing our resources. Over to you, Karen.
Thanks, Jackie. And it's Corinne Alberthsen now, just so everyone knows if you're trying to get in contact with me. So Jackie's given you a bit of a background rationale as to why I'm doing some of this research, and I'm going to try and fit 4 years of research into 20 slides, so it's going to be a really broad overview. I've got 5 main studies that I'm including in my actual PhD thesis, so if anyone wants to hear a little bit more in detail about any of my findings, come and find me over the next couple of days and I'm happy to talk to you about it. So to better understand the problem that we have with excess cats in Australia, we really need to know more about the problem and understand where the cats are coming from and what happens to them. And most people in this room, especially those that work in shelters, will have a good feeling for this, but there's nothing that's been scientifically validated. There's very little. So to begin investigating this problem in Australia, we decided to try and conduct a study of all the cat admissions and outcomes to the RSPCA shelters in Australia. And we tried to do this nationwide. So the overall aim of this research was to really describe the characteristics of the cat population that's entering shelters and then what happens to them after entry. So this slide just shows that we have a population of cats in our community. Some are owned, some are stray, some are lost, some are feral. A portion of them find their way to animal shelters and pounds, and then a significant portion of them are unfortunately euthanised. So my study is really looking at these 2 arrows, so how the cats are coming in and then what happens to them. So most people in this room will understand why I'm focusing on cats. So dogs and cats are both routinely euthanised in shelters and pounds as a management tool in Australia. But because so many cats are euthanised in comparison to dogs, and with the RSPCA they've got similar intake numbers for dogs and cats, but cats are overwhelmingly more likely to be euthanised. So I'm focusing on them. Obviously cats and dogs are really different species and they have different needs and requirements. So any strategies that we try to implement, we need to make sure that they're specific to the different species. So Jackie's already talked about this, that the difference between dogs and cats, but I'll just go through it quickly. And these are just from the RSPCA annual statistics for 2009, 2010. And we can see that there's some interesting similarities and disparities between dog and cat admissions. So the blue section, is that? Yeah. So the blue section there represents the percentage of each that have been euthanised. So that's about 29% of dogs and around 59% of cats. So the percentage of dogs and cats that are rehomed by the RSPCA is pretty good, and they're approximately the same, which is quite amazing. So this is represented by the red section there, and we can see that, in fact, they've rehomed slightly more cats than dogs, so 30% of cats and 28% of dogs. So the big discrepancy between the two is in the percentage that are reclaimed. So for dogs, 35% of them are reclaimed by their original owner, whereas only 4% of cats actually had an owner come and get them. And again, just there's a similar number of cats and dogs that are coming into these shelters. So despite the reports that there's a declining population of cats in our country and that there's a decline in cat ownership, the percentage of cats that have come into shelters and that are euthanised hasn't significantly increased or decreased over the past decade. So because there's so little published on cat admissions to shelters, the literature in Australia at present is limited to one study by Dr Linda Marston, and she looked at cat admissions to one really large animal shelter, and a cat-specific animal shelter in Melbourne. We decided that we would try and have a look at this nationally. So one of my studies, I've looked at all of the cat admissions to RSPCA shelters in Queensland, which was the first statewide study in Australia, and the rest of my work has been at a national level, and that hasn't been able to happen before. One of the reasons this hasn't been able to happen is previously, to collect this much data, it would have been just a mammoth task, because a lot of shelters were, and a lot of shelters still are, paper-based. And if there was a computer system collecting data in place, it was unique to that shelter. So I have 195,387 cat admissions from the RSPCA between 2006 and 2010, and I have about 30 variables for each cat, so I think it works out to be like 6 million data points that I have to work with, which is just an amazing amount of data. And we wouldn't have been able to get that sort of information previously. Luckily for us, the RSPCA has the ShelterMate system, or Shelter Buddy in the US, and nearly all of the shelters of the RSPCA in Australia are on this, so I was able to get a big dump of data and have a look at things pretty closely. Okay, so there is a lot of data, and this is really, really broad and all pulled together, and I'll go through some of the problems with doing this as I go, but I'll try and be quick. So one of the big findings that we've found is that overall, 80% of all the cats that are coming to RSPCA shelters in Australia are brought in by members of the general public. So only 18% were brought in by authorised personnel, and these are mostly council admissions. And this can vary depending on which state and which region you're coming from, because different areas have different requirements of council. And the 2% are other, so things that are bought in the shelter or transferred in. But overwhelmingly, it's just people in our community that are bringing those cats to those shelters. When we look at admission sources individually, almost half of all of them are stray cats. 31% were brought in by their owners, and the next significant portion is by council. And this is really driven by the Victorian shelters, because they have different council requirements, and they're a lot more active with their council work in that state. So when we separated the cats by age, so into adults or kittens, more than half were kittens. But there was a really big problem with doing this, and the results are a little bit difficult to interpret, because each state in Australia has a different definition for what a kitten is. So for Queensland, anything less than 3 months is a kitten. For Victoria, anything less than 4 months is a kitten. For South Australia, Tasmania, the ACT and the Northern Territory, anything less than 6 months was a kitten. And for WA and New South Wales, anything less than 12 months was a kitten. So this made it really difficult to compare and made some of my analyses much more complicated than they need to be. But for expediency and the purposes of this talk, I'm just going to pull everything together. So when we looked at just the general public admissions, all of the strays and owner surrenders fell into this category. So when we looked at these by adult and kitten, more than half of the general public admissions were identified as a stray. So that means the person presenting these cats did not identify themselves as the owner or an agent of the owner. Kittens in particular, though, regardless of age, were overwhelmingly stray. So 62% were brought in as stray, and only 38% could be had an identified owner bringing them in. So stray admissions make up such a large portion of the cat admissions to our shelters, which isn't really a big surprise. But what that really means, though, is that strategies that we're using to try and manage this, that target cats that are owned, so a lot of desexing campaigns and things like that, aren't going to be as effective for cats that are stray and don't have an identified owner taking responsibility for them. And this is a really large percentage of the cats that are coming in. So I also often get asked if most of the cats that are euthanised in shelters really are feral. So although we don't know the background of most of the cats that were brought in and that were categorised as feral, the results from my national study indicate that only 10% of all the RSPCA cat admissions were actually recorded as feral cats. But not all of these were euthanised. So 92% is still a huge number, but the small amount of feral identified cats that weren't euthanised were reclaimed by their owner, adopted, or the case was unresolved. So the yellow's the total cat admissions, the blue's adult, and the pinky colour's kittens. So of cats that were owner surrendered, 3% were categorised as feral. And one of the things is when cats are categorised as feral, there's no actual standard definition. So it's usually a behavioural observation. So that's really subjective and can be up to individual people in individual shelters. So it's really hard to compare this nationwide. But we clearly need more information about feral cats that are coming into shelters. And some of my results could just be a reflection of how a feral cat is defined in some areas. So of the cats that were surrendered by an owner, the most common reason for a cat in Australia to be surrendered to an RSPCA shelter was for an owner-related reason, so 91%. So owner-related reasons were ones that we categorised that were not associated with the cat itself, so that it was nothing to do with behaviour, age or any medical reasons. It's just because something to do with the owner that inhibited them looking after that cat and retaining it. So of the owner-related reasons, the most common was for accommodation-related things. And there were a small number of cats that were surrendered for behavioural reasons, which was a bit surprising. We expected a little bit more. And inappropriate elimination was the most frequent of them. So you can see when we separate it by adults and kittens again, it was owner-related reasons were still the most significant, but you can see that for kittens, almost all of the surrenders were associated with the owner. So the only difference in the owner-related reasons behavioural with the adults and kittens was that there was actually 7% of adults surrendered for behavioural reasons. And this was a little bit expected as older cats have had a little bit more time to acquire those undesirable behaviours. But accommodation was overwhelmingly the most common for adults. But then that's followed by too many animals, can't afford, unable to provide care and unwanted. So they were just in excess. So when we look at the most common reasons for kittens though, the most common owner-related reason was that they came from the own litter and they weren't wanted anymore. So the next few were there were too many animals and they were unwanted. So we can see that 66% of kitten surrenders are because there was just too many of them and they weren't wanted anymore. Just quickly for behaviour, for anyone that is interested, even though it's only accounted for 7% of surrenders overall, the reasons were really similar between adults and kittens, and you can see that inappropriate eliminations right up there, and also for being unfriendly and unsocialised. And not good with children is another common one. So we also looked at desexing, and we looked at, of the cats coming in, which ones were desexed prior to being admitted to a shelter. And overall, we had 36% categorised as being desexed prior to admission, which is the highest that's been recorded for any shelters in Australia, but that's still really, really low. We also found there was no difference between the percentage of genders that were desexed, so it was the same for males and females, which was pretty interesting. When we separated them by adult and kitten, 50% of adult cats were desexed when they came in. But only 22% of kittens, and that was expected as well. And the percentage of kittens that were desexed actually increased as the age definition increased, which was also expected. So one of the things that makes that really limits the power of this data is that only 55% of the cat admissions that I had were able to be categorised as either desexed or not. So that was a little bit tricky. But of the cats that were, and we decided to look at them by admission source to see, of the cats that are coming in, which ones are more likely to be desexed or not. So of the owner-surrendered cats, only 47% were categorised as desexed prior to entry. So this is really interesting because, as we were talking about yesterday, in Australia it's been documented in several states that we have a higher than 90% desexing rate for owned cats. So from owner-surrendered, we would expect a much higher percentage. It is a bit higher for adults, but it's still only 64%, so that's still not anywhere near the 90% desex rate we would expect. Interestingly, of stray admissions, 24% were actually desexed prior to admission. So this really lends evidence to the fact that not all of stray admissions that are brought in by people are really stray. They just don't want to pay the fee, or they're really suffering with the decision to surrender their cat to a shelter. But it also indicates that many of these stray cats have at some point in their lifetime been part of their own population. Council admissions were a combination of lost owned cats stray, feral, and so we would expect that the desexing percentages to be sort of in the middle of owned and stray. It depends on the community they're in as well. So we also looked at season, and this is something that everyone that works in a shelter sort of knows, but it's never been scientifically validated. And so we looked at cat admissions per season, and this is overall, so this is all cats by month. And you can see a really distinct pattern where there are less cats admitted to the shelters in the winter months, so between May to October. When we separated this out by adults and kittens, and this is one of the things where we really needed to take age into account because we really needed to know if there was a difference between the age definitions, we found that adult cat admissions didn't differ at all. And when we analysed this statistically, there was no significant difference between cat admissions between months. So there's no rhyme or reason, they just all come in constantly throughout the year. Then when we look at kittens, and this, as you can see, that this pattern happens irrespective of what the age category is. When we looked at kittens, there was a really strong pattern, and this pattern is so strong it's driving the overall pattern. So kitten admissions per month differed significantly. And you can see the real dip there in the winter months, and then if anyone came on Tuesday to Kate Hurley's talk, you could see Mount Kitten. This is just round the other way. This information is really important for shelters to know because it helps them allocate resources as they need it when they know that there's going to be a big tide of kittens coming in. And it also validates the timing for implementing really good strategies like desexing campaigns and things like that. They can go to their local councils and say, look, we can show you this is really happening. We need to get in 9 weeks before all these cats are coming in. The only thing that was a bit weird that we had a look at was the Northern Territory kittens actually didn't conform to the national pattern. And so what I did was, because there's only one RSPCA shelter in the Northern Territory, which is in Darwin, I took out the two most northern shelters overall from the rest of my data, which was Cairns and Townsville, and I compared their kitten admission patterns to Northern Territory to see if there was anything there. And we found that the Cairns shelter kitten admissions was almost identical to the Northern Territory, as you can see there, and that Townsville started conforming to the more southern states pattern. So this was really interesting, and it indicates that more research is needed to look into the effects of season, and that regional strategies are really important and they need to be localised, and one-size-fits-all thing isn't going to work. So of the outcomes, unfortunately, euthanasia was the most common outcome. 58% of all the cats in this study were euthanised. And as you can see, the blue is the adults, so slightly more adults than kittens were euthanised, and slightly less adults, or actually a lot less adults than kittens, were adopted. Another interesting thing was reclaim was low across the board, but particularly for kittens, with only 1% of them reclaimed by an owner. So one of the other outcomes that we looked at, we did look at microchip data. We wanted to have a look at how many cats that were coming into the shelters were already microchipped and how this affected reclaims and things like that. But due to the recording method, we were unable to reliably pull out which cats were microchipped prior to admission and which ones were microchipped once they came in. So for one of my studies, my statewide study of Queensland, I was able to sort of get a method that was an overestimation, but it was the most reliable way we could do it. And so even though it's still really unknown, for the 3% of overall admissions that were reclaimed, we looked at how many were microchipped, and only 13% of the cats that were reclaimed were also microchipped. So this is really, really low, and particularly as it's an extreme overestimation of the real picture. So knowing that information is really, really important for evaluating how we're going and how initiatives and strategies are actually working in our community. So the Queensland Government, as most of you will know, have just introduced in the last few years mandatory microchipping. And if we'd been able to have, well, this data indicates that microchipping wasn't working for reclaims in the past, so it would be really good to get this information in the future so that we can see whether microchipping is increasing reclaim rates in the future. So of the cats that were euthanased, the main reasons for euthanasia were for medical reasons, age-related, feral, being euthanised for being feral because of behaviour or because shelter resources were limited. So even though 18% were euthanised for being feral, was really interesting and just lends more support to such a subjective measure, because only 10% were actually identified as being feral in the first place. So it's more likely that, and because behaviour was about the same as feral, this sort of indicates that, and as ferals, based on behavioural observations, that 34% could actually be euthanized for sociability reasons, which makes a bit of sense. And something that I found pretty hard to take for the shelters was that 11% of the euthanasia was because they were really limited with resources. And, it's not a nice thing for shelters to have to do, and if they don't have the resources to do their job properly, they're forced to euthanize. And Kate also talked about that at her thing on Tuesday. And just quickly, when I separate them by age, you can see here that for kittens, being too young was the main reason they had to be put down. And for medical reasons, it was mostly for cat flu. And I think I'll leave it there because I'm taking up all of the time. But if anyone wants to ask me any other questions about other work that we did, I'll be around at lunchtime. Thanks.
Good. Thanks, Corinne. So, what strategies should we be looking at to make a difference? So if we look at the kittens first, over half the cats coming into shelters around Australia are kittens. And about 40% were from owned queens. Now, there is a differential. If someone said it was their own cat, they had to pay. So we suspect, in fact, this figure may be underrepresented because it's, obviously there's reasons why some people would not say the cat or the kitten was their own. But then it begs the question, if all these kittens are coming from owned queens, how's that happening? Because the data shows that Australia has one of the highest desexing rates for cats in the world. And in fact, the Queensland Household Survey, which surveyed people around Australia, around Queensland, reported 94% desexing rates for owned cats. Sydney reported 97%. So why are these kittens coming in? Well, the data shows also that between 30 and 70% of cats, although they are ultimately desexed, are not desexed before 6 months of age. In fact, a significant percentage are not desexed prior to 12 months of age. And data in both Australia and in North America shows that between 12 and 20% of cats that are ultimately desexed have at least 1 litter first before they're desexed. And some data we heard from yesterday from Moreton Bay, they reported the 20%. Oh. Bless you. So this was some information that I found was quite astounding, and it's from Peter Marsh's book about myths of overpopulation. And they calculated the number of kittens that theoretically were born from cats that were ultimately desexed was only numerically slightly less and was not statistically different from those that were born to cats that were never desexed. So it's clear that we need to reduce that spay delay. And so, something's happened here. But the message has to be that it's not good for the cat, it's not good for the kids, they must get around to it, and it's not too young. And there was an interesting study that was done in Victoria which really parallels data from North America as well. And they phoned people, and 33% of people who responded said they owned a cat. Another 22% said they were feeding a cat. They didn't perceive they owned it, and it wasn't the neighbour's cat. So this population of semi-owned cats is equal to about 2/3 the population of owned cats, and that's very similar statistics to North America. But only 20%, 1 in 5, are desexed. So those people are providing nutrition for reproduction, but they don't realise that they're really contributing to that overpopulation problem. And as Corinne mentioned, strategies that target own cats will have very limited effect on this population because they don't perceive they own them. And we really need to understand what drives this behaviour and what are the barriers to getting these people who feed a cat but don't perceive they own it to getting it desexed. And so one of the big challenges is this semi-owned and unowned cat population, because Corinne's data shows that feral cats only represent 10% of cats coming into shelters. So most have some socialisation. And most, about half the cats coming into the shelters are part of this group. And therefore, people who feed a cat but don't perceive they own them are a really significant contributor to kittens coming into shelters as well as cats. And so, a question for us to ponder is if this was a disease that was causing the death of 5 to 10% of dogs and cats annually in the community, how would we respond? I think very differently from how the general response is to this problem. And so what can we do? Well, clearly we need to focus on preventing unwanted kittens being born, and that's both owned kittens from owned queens, and from semi-owned and unowned queens. And so we need to target them with evidence-based strategies. And as I alluded to before, we're spending $250 million every year. And it's only recently that there is being significant amounts in some areas being invested in preventing the problem rather than just trying to to manage the problem, manage the animals that are unwanted now. But it's still a very, very small percentage of the budget. And I would make a case that we have to invest a lot more in stopping the problem rather than just managing it. And as you're so tight with resources, that's a very hard decision to make. Are you going to help those ones that are homeless now, or are we going to do something about the tide coming in? And this is some data, again, from Peter Marsh's book, Replacing Myth with Math. And there's a number of instances in North America showing that the biggest difference in dropping euthanasia rate, and this one's for cats, but it's both cats and dogs, the drop in shelter euthanasia rates over the past 30 years has been produced almost exclusively by a decline in shelter intake rates. So that would suggest that's where we need to be focusing our resources. So what are the strategies to prevent unwanted kittens from owned queens? Clearly, veterinarians need to include desexing in the initial preventive health program for kittens. It's got to be vaccinate, desex, all in the one package. And so for that to happen, it's going to require quite a mind change and a skill change. Professional organisations, the AVA, the Australian Small Animal Veterinary Association, need to embrace early age desexing. Universities need to train students in early age desexing. Currently, we did a survey, currently none of the universities in Australia and New Zealand are routinely training all students in early age desexing. But they can't do it alone. They need to partner with animal welfare organisations to make this happen. Universities in Australia, where the veterinary schools are really struggling financially, they don't have financial resources to do this, but they can do it in partnership with shelters, providing them the opportunity to train students, because every student needs to graduate with hands-on competence at doing early age desexing. But they also need to be motivated and see a reason to offering it to every owner who brings in a kitten for vaccination. So again, I think it's universities partnering with shelters to increase the awareness of the magnitude of the challenge that is facing shelters. And it's not just having them in community practice, learning, doing vaccinations and things like that. It needs to be a specifically targeted program discussing the challenges of the community and shelters with this unwanted pet problem. And I would particularly recommend that final year students do get hands-on experience in shelters so that they really are going out and graduating motivated to make a difference. And I think, has been alluded to before, the increased percentage of female graduates is helping. My feeling there's been a real change in the last 20 years as to how veterinarian graduate, our students, perceive this problem. And I'm really heartened by the attitude of students that I'm seeing in the shelter rotation, how committed they are and how they want to make a difference. And Sarah Zito is going to talk a little bit more about that program later this afternoon. So we talked about also that a significant percentage of kittens are coming from unowned queens. But they're socialised people, they're not feral. And so cats that are fed by people who don't perceive they own them, they equal to about 2/3 of the owned population, but only 1 in 5 is desexed. And it really needs research to understand the attitudes of people who feed cats but they don't take ownership, and what are the barriers to getting them to take that next step of ownership and at least have them desexed and identified. And then to develop social marketing messages based on that research and understanding of what's driving that behaviour, and provide opportunities for the desired behaviour. And Sibel May, who's sitting here, is one of the newest postgraduate students to join the Centre for Companion Animal Health. Her goal is absolutely to do that and to pilot that. We don't have any money for the project yet, but we've got a big vision to actually show the cost benefit to municipal councils and to shelters. If they put $100 into the community to stop these cats and kittens reproducing, how much does that save them ultimately in the shelter? There's some data coming from the New South Wales RSPCA where the shelter, or where the municipal council in Blacktown, I think it was, actually subsidised desexing so that the owner only paid half the desexing cost. And they got Deloitte's, a big accounting firm, to do some costing on that. And they've got data which suggests that for every $100 the municipal council spent subsidising desexing, it saved them $200 in taking that animal in. Now, it only really applied to dogs, and it suggests that different marketing messages need to be applied to people with cats to make that happen for cats as well. But if we can show that, then it will really change, I think, how municipal councils and shelters deploy their resources, if it's actually more cost effective to stop them coming in than to deal with them in the shelter. And Corinne's shown you this data about the kitten season. If you're working in shelters, you know this. You know there's that tide that starts to come in, and it's amazing how uniform it was across Australia despite different age categories for kittens being recorded. And so we need to be starting desexing blitzes, at least I think actually in April, May. And that's something that perhaps groups can get together and really target those people who wouldn't otherwise have their cat desexed. We also know from Corinne's data, and I'd make an argument that ShelterMate and Shelter Buddy is such a powerful resource. You know where the communities are that have a problem, and that's where you can target your resources. And so for strategies to prevent unwanted kittens from unowned queens, I think there's been a lot of information presented here that cost is a factor. It needs to be subsidised, and there needs to be the appropriate marketing message so that people who are feeding a cat who don't perceive they own it either stop feeding it and let it go elsewhere, or they take the next step of ownership. So we have to get that appropriate marketing message out there. And then who's going to do these subsidised desexings? And we talked about a whole lot of models yesterday, and I think that no one model is going to be the ideal model for every community. There will be dedicated veterinary practices run by animal welfare agencies that do this. The RSPCA's got the Paws van. I think one of the most powerful and cost-effective ways is to get veterinarians in the local community on board, and if it's once a month starting in April, you have a blitz, you target it for days, the practice is not so busy, and that winter period is often not so busy. They're not getting the ticks coming in, they're not getting the snake bites. So focus it, have the veterinarians on board. But who subsidises it? Government? Shelters? Are vets being asked to subsidise it? And I guess in most of those programs, vets are being asked to subsidise it. In terms of looking at strategies to prevent unwanted, owned adult cats, the data shows both in Australia and North America that many cats that are relinquished, and the same for dogs, visit a veterinarian in the preceding year. And in fact, the majority that are relinquished within 9 months of acquisition. So veterinarians are absolutely at the front line of preventing and managing behaviour problems. And I think there's a real need for being able to offer lower cost behaviour intervention. And I see veterinary nurses, veterinary technicians being at the forefront of that and being able to offer courses similar to what many puppy preschools, how some of those are run through veterinarians. So when the puppy comes in and it's mouthing or jumping up, or they mention the kitten is not using its litter box, the veterinarian can say, look, can you see Mary on the way out? Because every Tuesday night we have a session on, the barking dog or the kitten that's, not, or the cat that's not using the litter box, and we can help you. And it's only $10 or $20 for you to come along. And that really gives some career advancement for vet techs as well to be involved in that. And I think that it's such a powerful tool that is really underutilised at the moment. And obviously advising new owners on the importance of socialisation and training and preventing problem behaviours is critical. Strategies to prevent unwanted owned cats. It's clear that we need to rapidly address the increasing unavailability of pet-friendly accommodation. And we need to develop strategies that work to change attitudes of landlords, body corporates and real estate agents. Because when I calculated up the number of adult cats and kittens just from the RSPCA data, it's over 10,000 cats and kittens that are made homeless every year. But when I made an estimation adding in municipal council data and other shelter data, it's probably 30 to 40,000 cats and kittens that are made homeless every year because the landlord won't allow them to be in the apartment. And we know that cats really, they cause minimal problems. And there's a lot of data out there, enormous amount of data, that pet ownership benefits the community. And in fact, it's been shown that owning a dog or owning a cat saves the Australian community $1.8 billion every year in reduced doctor's visits and medication for high blood pressure, heart disease, depression, and high cholesterol it was. So we have to be getting that message out. It's good for the community's health to own a cat or a dog. There is no reason that 40,000 cats and kittens should be made homeless every year, and many of those being euthanised. So I'd just like to conclude, we do need research to inform evidence-based best practice in both shelters and the community. We need to focus on decreasing the kitten influx. We certainly need to focus on both the owned and the semi-owned cat populations, better understanding what's really stray. And for a first this year and for the next 4 years, RSPCA Australia, in collaboration with RSPCA Queensland, have announced they're going to fund a master's program at the Centre for Companion Animal Health. And Sarah Zito here, who's going to talk to you about our rotation program, is doing the first masters, and she's really looking at, what are those stray cats? Are they really stray? What are owner perceptions about them? And what are perceptions about those cats that people are bringing into shelters? We need to understand what campaigns are the most effective to reduce reproduction. We've heard about some great programs in Australia and New Zealand, and we need to be looking at the cost effectiveness of them. Which ones are the best ones to roll out? What desexing campaigns are most effective? Corinne's data certainly shows that there's a much greater need to understand some of the issues with microchipping. Why are so few cats being reclaimed, and of the cats being reclaimed, why so few are microchipped? Is it because when the shelter calls those people up where the cat is microchipped, they can't get hold of them? Their address, their phone numbers are all out of date. If a significant proportion of them, that's the case, then there's strategies like when people connect their electricity on, or they change their postal address, there needs to be a tick box also, is please contact the database for my cats and let them know that my cat or dog has moved. So they just have to tick that. But if the problem is that they're actually not even being registered with the database, we need to address that. So we clearly need to understand, given that it's now compulsory, at least in Queensland and some of the other states, to microchip your animal, we need to make it effective. There's no point in having a program that doesn't work. And I do have a postgraduate or a student who's interested in looking at that, if we can get some funding for it. But it all needs dollars. And I'd just like to acknowledge some of the sponsorship that Corinne's received for her project. Guy Franz is a donor from New South Wales, no connection with the University of Queensland, but could see the real need for her research. The Elsie Cameron Foundation has helped out, PIS, Hills has given us a little bit, and we got a small grant from the Animal Welfare Trust, which is part of the Australian Veterinary Association. And I'd really like to just commend the RSPCA on this collaboration. It took foresight, it took vision, and it took a lot of trust to provide us with all that data, and I think it's a very, very powerful tool. And I think also for those councils and shelters that are not on ShelterMate, please go and see Mark Townend and get you signed up, because it is such a powerful tool to know where is the problem and how are you doing. So I'm happy to take questions, and I'm sure Corinne is too.